In a bid to commemorate the 2024 World Malaria Day, the Pediatric Association of Nigeria, PAN, has stressed the need to not relent in the ongoing fight against malaria, with a focus on the theme, Accelerating the Fight Against Malaria for a More Equitable World. Let's change the narrative now. Professor Ekanem Ekure, president of PAN, noted that malaria accounts for 60% of outpatient visits and 30% of hospital admissions in Nigeria, making it the leading cause of death among children under 5. In 2021, Nigeria recorded 68 million malaria cases and 194,000 deaths, with approximately 80% of those cases involving young children. Despite progress in combating malaria, much more needs to be done to protect vulnerable populations. PAN acknowledged existing efforts in deploying vector control, chemo prevention, and improved anti-malarial treatment, but outlined a need for additional strategies. Now, to discuss this, we're joined by Dr. Zakari Usman, Chief of Party Partners for Healthcare Nigeria. Hello, Doctor. Good evening, and thank you so much for joining us.
Good evening, and thank you so much for having me. It's actually partner in health.
Yes, indeed. All right. So, Doctor, can you share with us the primary barriers that children and Nigeria actually has to equitable access to malaria interventions in the country?
Oh, thank you so much. Primary barriers to equitable access to malaria prevention, basically, it's multifaceted. One of them is the geographical barrier. There are some people who live in places tagged as hard-to-reach areas, people who live in hard terrains, people who live in the creeks, people who live in the riverine areas where appropriate means of transportation are not available, and some persons that live in IDP camps. Those some of them are not easy to reach geographically. Others, other facilities, some places do not have healthcare facilities, some are poorly equipped. There is also the socioeconomic divide. Some persons do not have the financial power, to access healthcare, and even when they do, it's almost impossible for them to pay for the services. That also is one of the reasons why one of the barriers, to malaria prevention. Equally, the issues around healthcare practitioners, the knowledge of the healthcare practitioners, the availability of facilities in terms of diagnostics. For malaria, we have the rapid diagnostic test, which has made diagnosis of malaria cases a lot easier as against the microscopy that we used to do in times past. But these items are not equitably distributed across all healthcare facilities. There's also the issue of stockouts, of essential drugs in most health facilities. So some of these are what cause the barriers, as well as issues around gender inequity and gender inequality.
All right, Doctor.
All right, Doctor. As a result of.
If you can hear me, yeah. Dr. Usman, has there been any collaboration between, the Nigerian government, between them and health practitioners and other partners, especially in tackling malaria? If yes, what specific approaches are showing promise in reducing the malaria burden among children? Because we know in some countries they've already started vaccinating children against malaria.
Yes. Oh, thank you so much. Yes, there's been a lot of partnership. It's a multi-sectoral approach. And there's been a lot of partnership with subnational governments, with development partners, with international donor agencies, with even corporate bodies. One of such partnership is what you just heard earlier. The Pediatric Association of Nigeria have come out to show their support, for efforts towards malaria control. That's a partnership that works for us. And of course, we've also had some form of support from the USG through the President Malaria Initiative. There's an ongoing program across some states, I think about 12 states, I think, on impact, which is one malaria. Some of them are supported by World Bank, some are supported by Islamic Development Bank. All of them are geared towards providing, the supply chain items, the drugs, the logistics, malaria preventive logistics, like the long-lasting insecticidal nets and all of that. And talking about which of the approaches has worked, in malaria prevention, basically is a multi-pronged, multifaceted approach. For children under 5, one of the ones that has demonstrated a lot of potentials to help go a long way to reduce the burden, both in mortality and morbidity of malaria, is the seasonal malaria chemo prevention. Under the seasonal malaria chemo prevention, what happens is that they use a drug combination. They call it SPAC. It's sulfadoxine, pyrimethamine, and amodiaquine combination. And it is targeted mainly from April to October, around the rain period, around the rainy season in Nigeria, so that at least they can reduce incidences or clinical cases of malaria,
okay, now,
severe forms of malaria,
about,
and even prevent the children
talking
from having
about
malaria.
these incidences, Doctor, what role do you think that health practitioners can play in addressing gender inequalities and discrimination that contribute to a heightened risk of malaria?
Thank you so much. The healthcare inequality as regards malaria, one is self-development, to know, what the challenges are, and then of the community in terms of what is required, what is even the gender discriminatory, what constitutes.
All right, we seem to be having issues connecting with Dr. Usman, but thank you so much, Doctor. We appreciate you for your time and speaking on this.